cerebral palsy? What does it affect? How do you get it? Is it preventable? A few questions that I'm sure you might ask about it. Many people don't know, but let me fill you in a little bit. My name is Piera. Here we go. Cerebral palsy is a medical condition that affects the control of the muscles. It is caused by an injury to the brain before, during, or shortly after birth, when the brain receives a lack of oxygen. It controls motor skills such as walking, talking, and eating. CP affects 750,000 Americans. The first documented history of CP goes back to the 1860s, when William Little came across a condition that affected young children, causing stiff, spastic muscles in their legs and slightly in their arms as well. It is harder for them to do things that other children find easy, like grabbing objects or even simply crawling. These children never get better, but with therapy, they can learn how to independently be capable. CP is a commonly misunderstood condition, and understanding it is the first step to preventing it. One of the most important factors of CP is that it is preventable. Tests and prenatal care can prepare a woman and alert her when possible causes arise. Pregnant women are tested routinely for the Rh factor. If the Rh factor is negative, they can be immunized within 72 hours after birth. If she has not been immunized, the blood incapability can be prevented by exchange transfusion in the body. Here are a few facts about CP. More than 764,000 children and adults in the U.S. have one or more symptoms. Here are some other interesting facts that you might have not known. Treatment for CP varies from person to person. It is based on the patient's needs and problems. One of the most important and main treatments is physical therapy, which is used to decrease spasticity, strengthens muscles, and teaches proper function motor patterns. Occupational therapy focuses on your hands and arms. Exercise therapy is very important because the practice of it helps your body also. Important exercise therapies are swimming and horseback riding, which are very, very common. Speech and language therapy are also used. Sign language is an important key factor. Behavioral therapy, which uses psychological therapy and techniques to reinforce behavior and discourage negative behavior. Your family is very, very important, huge members of treatment, providing children with love and care and giving them determination. There is also medication to alleviate symptoms, but it is less common to help out the patient. Studies have shown that adults have had a huge amount of childhood physical therapy, which is commonly 4 to 5 times a week, over a long period of time, have had negative lasting effects with children and aging of cerebral palsy. In order to live with CP, the patients must get the right nutrition, exercise, and socialize, whether at school or simply at work. Doctors don't know exactly what the life expectancy of adults with cerebral palsy is, but they know that it varies from 30 years to 60 years, depending on how severe the case is. Through courage and determination, it is possible for anyone with CP to reach their dreams and their goals. Some famous people with CP include Michael Avion, that started at Emperor's New Clothes, Chris Fonseca, that does stand-up comedy and has been on several shows. Several writers also have CP, such as Christopher Nolan and Christy Brown. The most famous and recognized person with CP living is Jerry Jewell, who played Blair's cousin and guest starred on Facts of Life, and also was on HBO's Deadwood. The most important hero to myself is my little cousin, Michael. He is 10 years old and has lived with cerebral palsy. I watched him grow through it, and I've helped him through it. And seeing him day to day suffer, but also get better, has encouraged me to do physical therapy to help children with his things. Thank you very much.